Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about known case letter. So especially how to write for the patient's own GP, how to identify it is a known case letter, and how to write an introduction and a medical history paragraph and a recommendation paragraph. Okay, so let's move on to the details. For example, in the writing task, if you are having the task as writing Mr. X GP, apostrophe S and GP, which means it is a known case letter. And if they have given Mr. X family doctor, it is called it also known case letter. And if they have given Mr. EX return to the nursing home, which means we have to compare the address of the writing task as well as the patient details address. So that both address are same, which means the patient where the patient came for the admission, the same place patient is transferred back, or else patient is referred back to the same place. So which is called it as a known case letter, which means we are writing that letter to the same person who is going to look after the patient even after the discharge from the hospital. Okay, so Mr. X GP, Mr. X family doctor, and if the patient is transferring back to the same nursing home or the retirement home where the patient have been there for few years or have been looking after by the same people. So this is called it as a known case letter. This is a way we have to identify from the writing task, either we are writing a known case letter or it is a referral letter or discharge letter or transfer letter. Okay. So now coming to the point of introduction. So how we can write an introduction for the known case letter. So if you are writing a letter to the patient's known people, like who knows the patient already, but they does not know what is the current problem of the patient. So in that situation, when you are writing a letter to the known case people, it is better to start the letter, I am writing to update the current condition of. Because here it is not good to start I'm writing to refer, because it's not a new patient for them to refer the patient, right? So instead of that, I'm writing to update the current condition, because they know the background of the patient but they does not know the current condition of the patients, what is the current medical status of the patient. So that's why it is good idea to write an introduction. I'm writing to update the current condition of Mr. X and what is the diagnosis of the patient, and writing the purpose, so what they have to do for their patient. Or else you can start even with the name like Mr. X, and then you can write the diagnosis and then you can write the purpose. This is a way also you can write, but which is not right way to write, which means I'm writing to refer. That is not right. And if you are writing, or if you are writing a letter and you are transferring the patient to the same retirement home or the nursing home, so in that situation you can write I'm writing to transfer back, I'm writing to refer back. Like that also you can write it. It is a good idea to write it like that, introduction. So for known case letter, it is a good idea to start an introduction. I'm writing to update the current condition of, I'm writing to transfer back, I'm writing to refer back. So or else if you don't want to follow any of this pattern, you can follow like just start patient name and write the diagnosis of the patient and then just write the purpose of the patient. So this is the way we can write an introduction for the known case letters. Okay. Now coming to the point of present medical history paragraph. So many members are having a doubt like how we can start the present medical history paragraph if the patient is having multiple visits by a community nurse who is doing a home visit for the patient as per the GP's request, and writing a letter to the patient's GP about the current condition of the patient, or if the condition of the patient is worsening, we are just escalating to the patient's GP for the further treatment and management. So in that situation, how we can start the present medical history paragraph. So here, for example, there are 4 visits. So that 4 visits, not necessary to write the first 3 visits, like during the first visit, during the second visit, during the third visit. So altogether you can write Mr. X has been under my home request as your under my home visit as your request. During my visits, so we are putting it as a plural, visits. What happened, that all you can write it together, in which, as I said, 4 visit means first 3 visits can be written it in one passage. The last visit, today visit, because the 3 visits have been managed by a nurse while she was doing a home visit. But the last visit she unable to manage it, thereby she is writing this letter to the patient's GP for the further care and management. So that today's history is most important. So that has to be separated. So during today's visit, during my today's visit, on the date and write the complaints. If any vital parameters are abnormal, better to elaborate it and then just give a clarity to the GP, which means who is the reader of the letter, they will get it. Okay, these 3 days of the first 3 days of the visit which have been managed by a community nurse, but the last visit was little which is worse than before. That's why she is referring my patient to me and for the further care and management. So that clarity will get it from the 2 days visit. So it is better to write it. Why I'm asking to separate it, which means because here we no need to write the social background of the patient, because known case letter, it is not necessary social background, because they already know the person and also they know about his background, entire background, about his past medical history and the medication history, and they know about his living status and family background and everything, because as a GP, which means basically they have been seeing this patient for years and years, so they of course knows that. But current situation of the patient, they does not know. That's why we are just giving a hint to the GP. So that's why social background is not mandatory for the patients, GPs, or if you're writing a known person, which means the patient who have been living in the retirement home or the old age home or in the nursing home, they are also knows about him completely. Only after admission in the hospital, what happened to the patient, what treatment we have given to the patient, and what they have to follow, that is the information they does not know it. So in that situation, it is better to write it only the present medical history passage in an elaborated way. As much as possibly we have to elaborate it and write it. There no need of concise and clarity manner. Okay, like you can elaborate it, but that has to be given a clarity for the reader that what you want to try to say about your patient present medical history. Okay, so this is the way we have to write it. And if it is like patient came from the retirement home, patient came from the old age home or the nursing home, which means it is good to start like, it is good, it's not fault, it's good to start as you are aware, because without their awareness the patient won't get admitted. If the patient come from the retirement home, or if the patient come from the old age home, or if the patient come from the nursing home, sometimes GP itself refer the patient for the further treatment and management to the emergency department or to the hospitals. So in that situation, you can write as you are aware, comma, and then you start the passage, present medical history paragraph, this day patient got admitted with the so and so complaints, and then what treatment you have given. It is not wrong. If you are not writing also, is no problem. If you are writing also, it's okay, no issues in that. Okay, and then coming to the point of recommendation paragraph. So how will you write the recommendation paragraph? Recommendation paragraph, like some people, for example, if you're writing to the GP, a community nurse who is doing a visit to the patient at home, and she is referring the patient to the patient's GP. So in that situation, how will you write the patient's recommendation paragraph? So here you can write the patient recommendation paragraph like, it would be greatly appreciated, it would be highly appreciated if you could look after, if you could assess, diagnose and treat the patient as you feel appropriate. Your concern on his condition is immensely appreciated. If there is no recommendation advice, just you are writing to the GP just for the further investigation and treatment, just for the further assessment and treatment evaluations. In case if the patient is getting discharged from the hospital and we are referring to the patient's GP, or going back to the retirement home, old age home or the nursing home, which means there what recommendations they have given, that you can write it. And maximum try to avoid the continuity of care, ongoing care and management, further care and management. This are all in the purpose. Just specify the purpose, because purpose is carrying the more mark in the introduction. That is very important part of the introduction also. We can say as a vital part of introduction as well. So in that situation, better to write a specific purpose in that introduction, rather than writing a further care and management, ongoing care and management, continuity of care and management, continued care and management, because that won't give you more mark in the introduction, and also that won't impress the reader of the letter. So it is specified. For example, he needs your assistance for activities of daily living. He needs medication monitoring and social supports, and he needs wound dressing management and assistance for activities of daily living. So like that, just highlight the purpose, which is very important in the introduction. Okay, so this is the way you can identify the known case letters, and this is the way you can write the letters. This is just an idea. This is the way we can write it, but based on our knowledge and skills, we can utilize. But just don't forget writing an introduction in a good way. That is very important. And also not necessary to add the social background, because social background is unnecessary for the known people of the patients. Okay. I hope this discussion might help you people, whomever is preparing for their upcoming exams, and whomever wants to join in our class. Our number has given in our description. You can contact us at any time. You can join in our class. We have 30 days, 20 days, 25 days, 10 days mock batch and a crash course, and we have 60 days, 45 days, 50 days, and also just 2 modules, writing and speaking. So these classes are going on. So whomever wants to join our class, call us immediately and join. Okay. So until then, bye bye.